for this station. Here is your stem. Since I have only one slide, so you can take as much time as you need.
Yes, ma'am, I'm ready, ma'am.
All right. So if you've read and understood considering it communication skill station, please begin. Please begin.
Hello,
Yes.
I'm Dr. Ashik. I'm a SHO here. May I know to whom I'm speaking with?
Yeah, I am the on-call consultant.
Hello, doctor. So
Yes.
my call is regarding a patient who underwent right colectomy, hemicolectomy, and the patient output is not adequate. So I need your opinion regarding this.
Yes, sure. Go ahead. Can you please tell me more about your case?
Yes, doctor, I will do it. The patient is a 69 years old female, diagnosed with cecal carcinoma, who underwent right hemicolectomy post-operative day 1, and she's having suspected liver metastasis for which biopsy has been taken. And
Right.
the complaint is the patient is tachycardic. Her BP is her blood pressure is 90/60, and her output is 10 to 20 ml for the last 8 hours.
All right. So what do you think the cause of this?
Keeping in mind, doctor, the above scenario, I would think the patient is not having proper fluid the patient is not given proper fluids.
Okay. So why creatinine is high?
Doctor?
Why she have this high creatinine?
Yes, that is
What
probably
do you think
because of inadequate fluid. So the patient is having a high patient is going for acute kidney injury. So that is the reason why creatinine is high.
Yeah,
And
so it's she's dehydrated as well, right?
Yeah, dehydrated,
Okay.
yes, doctor.
Yes. Okay. What in view of the clinical state, what is your plan of action?
So I would resuscitate her with fluids. So probably 1 liter of normal saline I will give over 1 hour, and I'll monitor her vitals in the ward. So I will repeat her lab values tomorrow, and I will check her hemoglobin levels as well. So the next day I will assess the patient's output and hydration status. And if it is inadequate, I will shift her to high dependency unit. I will start central line and monitor her vitals. In case if
All right.
her hemoglobin is dropping, I will transfuse blood.
All right. Is it? Do you think is it better to give 1 liter of normal saline, or is it better to give bolus of fluid challenge? What do you think?
It is. I would prefer giving fluid challenge, doctor.
Yes. And how much you will give in this
I will
case?
give 200 to 500 ml in 15 minutes.
And what is fluid type of fluid?
Crystalloids. I'll be giving her crystalloids.
All right. And for how many time you will repeat?
I will repeat for 3 times, doctor.
Okay. Yeah. Meaning 4 time or 3 time?
4 times I'll repeat.
Okay. Okay. Then after 4 time, repeat it. What you will do if no response to fluid challenge?
I will shift her to I will suspect if there is any bleeding, ongoing bleeding. I will check. I will shift her to high dependency unit. I will place her with the central line and I'll monitor.
All right. Okay. And how will you monitor her and for the response of this fluid?
I will check for her blood pressure, her heart rate, capillary refilling time, and her urinary output.
And do you think that this patient is bleeding?
No, doctor. I don't think so. Maybe she can bleed, but as of now, I don't think so, doctor.
How you
Right.
tell this? What is your evidence?
The patient is not having evidence of hemoperitoneum. There is no abdominal
right.
distension, and
All right.
so keeping that in mind, I might.
Okay. And what we will do if for the abdomen? So you suspect this maybe, but what you will do further?
Pardon me, doctor. I didn't get you.
All right. I'm asking what you will do further for the abdomen. Are you going to do more assessment?
Yes, doctor. I will monitor the vitals and I will do a series of ultrasound, abdominal ultrasound,
All right.
and I will check for any signs of bleeding.
All right. And tell me if there is any problem. Okay. What are the signs of hypovolemia and how you know the patient is bleeding? How you know
The
if the
signs of
patient is bleeding?
with the help of blood pressure, tachycardic, tachypenic. I'll check her
All right.
vitals, and I will see if there is any signs of bleeding elsewhere.
All right. And if there is any sign of peritonism, and you check the hemoglobin also, right?
Yes, doctor.
Okay. Do you think she's having anastomotic leak?
No, I don't think so, doctor. Because there is no signs of peritonitis. The patient is not toxic, and there is no obvious abdominal signs. So I don't think so. The patient is having anastomotic leak.
Okay. Do you need me to come and check the patient to see the patient?
I will start the patient with fluid challenge, doctor. I will assist, and then if required, I'll subsequently inform you, doctor.
All right. And does she require an operation now? Do you think?
No, I don't think so, doctor.
All right. And if the HDU is full after resuscitation, no response, and the HDU is full, what you will do? And who will go? Are you going to speak to?
I will talk to the bed manager, and if the HDU is full, I will consider shifting the patient to ITU, and I'll consult with the ITU registrar. Prior to that, I will put a word to my consultant regarding the patient.
Okay. So do you think this patient is shocked?
Yes, doctor. The patient is in shock.
Okay. So what is the causes of shock in this patient? Could be
Hypovolemia, doctor. Inadequate fluid resuscitation is the cause.
other cause you may suspect that causing this shock and oliguria
Third space fluid loss, ongoing bleeding. If there's any ongoing bleeding.
or sepsis. Okay.
Yeah, or sepsis, yes, doctor.
What do to do the fluid challenge for her?
Pardon me, doctor. I didn't get you.
What is the effect of the fluid challenge?
Resuscitation.
Okay. Is that patient require hemodialysis, do you think?
No, doctor, I don't think so.
So what is the indication of hemodialysis?
The patient, if there is ongoing acute kidney injury and if the output is not adequate in spite of fluid challenge, and if the patient is overhydrated, I will think for dialysis, doctor.
Oh, okay. Thank you very much. Oh, okay. Keep me updated. Yes. Okay.
Thank you. Thank you.
Time has gone. That's why I've changed it to thank you. My one last question. What is the criteria for patient to be shifted to high dependency unit?
Sorry, ma'am. I don't know, ma'am.
Yes. And to answer, if you don't know, then you say, I'll come back to this question later. So my next question is, what would you do if this patient drops saturation suddenly? What would you suspect and how would you manage? This same patient, saturation drops, what are you going to do?
If there is a saturation drop in this patient, I will secure the airway. I will put the O2 mask and I'll keep the patient with oxygen. And
what is your provisional diagnosis that you're going to suspect?
Fluid overload, ma'am.
Pulmonary
Embolism. Yes.
Pulmonary,
Look,
okay. No, I thought after giving fluid challenge.
No, fluid challenge you are giving, but all of a sudden this is tachycardic,
Okay, that is
hypotensive. Yes.
Pulmonary
And
embolism.
yes. And yes, pulmonary embolism, because here the operation was done hemicolectomy. So patient is bedridden because of tumor, cecal tumor. So tumor is, yes, hypercoagulable state. So saturation drops. That means patient is going
for
pulmonary embolism. So, all right, I've forgotten my next question. All right, yes, we'll discuss the types of shocks. Okay, good. Thank you.
Thank you.
And the criteria